Good day. My topic for today is about general survey and vital signs. At the end of my lecture, I hope you can be able to describe the important aspects of general survey of the patient and then identify the components of measurement and vital signs. So what do you mean of general survey? It is the study of the whole person. It covers the general health state and any obvious physical characteristics. It is an introduction wherein it will be followed by physical examination. And general survey will give us an overall impression of the person. The general survey of the patient's appearance, height, and weight begins with the opening moments of the patient encounter. But your observations of the patient's appearance often crystallize as you start the physical examination. The best clinicians continually sharpen their powers of observation and description. As you talk with and examine the patient, heighten your focus on the patient's mood, build, and behavior. These details enrich and deepen your emerging clinical impression. Your goal here is to describe the distinguishing features of the patient so clearly that colleagues can spot the patient in a crowd of strangers, avoiding cliches like middle-aged gentleman and the uninformative in no acute distress. So part of the general survey is looking for the general appearance in terms of apparent state of health, level of consciousness, signs of distress, skin color and obvious lesions, dress, grooming, and personal hygiene. You will look into the facial expression of the patient, odors of the body and breath, posture, gait, and motor activity, height and weight, and then you need to calculate also the BMI. So let's go to the apparent state of health. In the apparent state of health, you have to try to make a general judgment based on your observations throughout the encounter. Support it with the significant details, like is your patient acutely or chronically ill? Then check also if the person appears his or her stated age. You can check the pubertal staging if sexual development is appropriate for gender and age. Next is the level of consciousness. You have to observe if your patient is awake, alert, and responsive to you and others in the environment. And if not, promptly assess the level of consciousness. So again, check if the patient is alert and oriented and attends to your questions and responds appropriately. So you have to look for alertness, if it will respond to verbal stimulus or painful, or if your patient is unresponsive. How to check the level of consciousness is through Glasgow Coma Scale. What is this? It is divided into three: eye-opening, verbal response, and motor response. And the highest score that you can give to the patient is 15. Next is the signs of distress. For the signs of distress, you look at your patient. Does your patient show evidence of cardiac or respiratory distress? Is your patient in pain? Or is your patient experiencing anxiety or depression? Next is the skin color and obvious lesions. In skin color, inspect for any changes in skin color. If the color tone is even, and check the pigmentation because it varies with genetic background, and if the skin is intact with no obvious lesions. Also, skin color can also tell us some conditions such as pallor for anemia, cyanosis, jaundice with yellowish skin or yellowish eye, bruises, or mottling. Mottling is caused by heart no longer being able to pump blood effectively. Usually, blood pressure drops, causing extremities feel cool to touch. Next is dress, grooming, and personal hygiene. You have to check how is the patient dressed. Is the clothing suitable for the temperature and weather? Is it clean and appropriate to the setting? Note the hair, fingernails, and use of makeup because it gives us clues to the patient's personality, mood, lifestyle, or are there body piercings or tattoos? Next is the facial expression. Next is the facial expression. You have to observe the patient at rest, during your conversation, or ask the companion how the patient interacts with other people, and during your physical examination. So watch the stare of hyperthyroidism and look at the other patient. There is decreased eye contact. It may suggest anxiety, fear, or sadness. Next is to check the odors of the body and breath. Odors can be important diagnostic clues. For example, fruity odor for diabetes persons. And if you are entertaining intoxication of alcohol, then you have to smell if there is scent of alcohol. Next is the posture, gait, and motor activity. Check the posture of the person at it stands comfortably erect if it's appropriate for age. So you need to check what is the patient's preferred posture. Is the patient restless or quiet? How often does the patient change position? Is there any involuntary motor activity? Are some body parts immobile? And if yes, which ones? Does the patient walk smoothly with comfort, self-confidence, and balance? Or is there a limp, fear of falling, loss of balance, or any movement disorder? In posture, there are also exceptions, like a standing toddler who has a normally protuberant abdomen. They have toddler lordosis. For elderly, aging person who may be stooped with kyphosis. Take note also that other postures can tell us the condition of the patient. For example, in this tripod position, and if you check there are respiratory retractions, so it can tell that the patient is having difficulty of breathing. Check also for any gait abnormalities. Check the motor activity if there are tremors or paralysis. Let's go now to the height and weight. Check, is the patient unusually short or tall? Is the build slender, muscular, or stocky? Stature, height appears within normal range for age, or is there any genetic heritage, such as Turner syndrome, which are shorter than age? Is the body symmetric? So you have to note the general body proportions. Is the patient slender overweight or obese? If the patient is obese, is the fat distributed evenly, or is it concentrated over the upper torso or settled around the hips? So make note of any weight changes. Body build, contour, proportions must be correct. How to check? Arm span is from fingertip to fingertip usually equals the height. The body length from crown to pubis roughly equal to the length from pubis to sole. Take note also if there are obvious physical deformities. Note any congenital or acquired defects. Next, we'll go to the calculating the BMI, or body mass index. To determine the BMI, choose the method best suited to your practice. You can use a standard BMI table or the electronic medical record software, which frequently shows the BMI automatically. You can also calculate the BMI using one of the methods here. BMI equals to weight in pounds times 703 over height in inches squared, or weight in kilograms over height in meters squared. Then after you have the answer, you have to interpret. Then check the score. If it's less than 18.5, that means your patient is underweight. If it's 18.5 to 24.9, that means it is normal. If it's 25 to 29.9, that means your patient is overweight. If it's 30 to 39.9, obesity or obese 1. If it's more than 40, morbid obesity or obese 2. If the BMI is more than 35 kilograms per meter, measure the patient's waist circumference just above the hips. Waist to hip ratio will assess the body fat distribution as indicator of health risk. Risk for diabetes, hypertension, and cardiovascular disease increases significantly if the waist circumference is 35 inches or more in women and 40 inches or more in men. Obese persons with a greater proportion of fat in upper body, especially in abdomen, are called android obesity, while obese persons with most of fat in hips and thighs, they are called gynoid obesity. Here is an example of writing your general survey. Example is, the patient is a moderately obese, young adult Caucasian male who appears his stated age of 33 and is in no acute distress. Patient ambulates without difficulty and moves freely. He appears well groomed, clean, and is dressed in an examination gown. Patient talks freely but appears to be somewhat anxious. Let's go now to the vital signs. Examples are the temperature, pulse rate, respiratory rate, and blood pressure. The core body temperature measured internally is approximately 37 degrees Celsius and fluctuates approximately 1 degree Celsius over the course of the day. It is lowest in the early morning and highest in the afternoon and evening. Women have a wider range of normal temperature than men. Although the research gold standard for core body temperature is the blood temperature in the pulmonary artery, clinical practice relies on non-invasive, like getting the oral, rectal, axillary, and tympanic membrane. Take note that the normal oral temperature of a resting person is around 37 degrees Celsius or 98.6 degrees Fahrenheit. Ranges from 35.8 degrees Celsius to 37.3 degrees Celsius. How to get the oral temperature? You can use the glass thermometer, but in the Philippines, it is already prohibited to use any using mercury. So we are using now the battery-operated thermometer. How to check? If you're using the glass thermometer, shake the thermometer down to 35 degrees Celsius or below. But if you are using the battery-operated thermometer, just click or turn it on. Then make sure that your thermometer is clean. Insert it under the tongue. Then instruct the patient to close both lips. Wait for 3 to 5 minutes and then read, or wait for the battery-operated thermometer to alarm. Also, before getting the oral temperature, you need to ask your patient if the patient just drink hot or cold liquids, or if the patient smokes before coming to the hospital. Why? Because all of this can alter the temperature reading. And if your patient says yes on any of this, then you have to delay getting the oral temperature for about 10 to 15 minutes. Oral temperature taking is not recommended when patients are unconscious because they cannot close their mouths, or if your patients are restless. Then your patient is conscious but unable to close their mouths. Rectal is the most standard because it is nearest to the core body temperature. So the rectal temperature is usually 0.4 degrees Celsius to 0.5 degrees Celsius higher than the oral temperature, while axillary temperature is 1 degree Celsius lower than oral. How to get the rectal temperature? Ask the patient to lie on one side with hip flexed. Then, don't forget to lubricate it and insert your rectal thermometer about 3 centimeters to 4 centimeters or 1.5 inches into the anal canal in a direction pointing to umbilicus. Then, remove it after 3 minutes, then read. The tympanic membrane shares the same blood supply as the hypothalamus, where temperature regulation occurs in the brain. However, it is affected by cerumen impaction and otitis media. Tympanic membrane temperature is quick, safe, and reliable if performed properly. It measures the core body temperature, take note, which is higher than normal oral temperature by 0.8 degrees Celsius. Now let's go to the pulse rate. Remember stroke volume, the amount of blood every heartbeat pumps into the aorta. So when palpating the peripheral pulse, it gives the rate and rhythm of heartbeat. How to check the pulse rate of the patient? With the pads of your index and middle fingers, compress the radial artery until a maximal pulsation is detected. After checking, if the rhythm is regular and rate seems normal, you can count the rate for 15 seconds and then times 4. However, if the rate is unusually fast or slow, then you need to count it for 60 seconds or 1 minute. If the rhythm is irregular and rate, it should be evaluated by cardiac auscultation. Beats that occur earlier than others may not be detected peripherally, and heart rate can be seriously underestimated. When assessing the pulse, you have to include if the rate is less than 60, if it is bradycardic. And if it's more than 100, it is tachycardic. Second, check if the rhythm is regular or irregular. Third, check the volume if it's weak or strong. Now let's go to the respiratory rate. Count the number of respirations in 1 minute either by visual inspection or listening over the patient's trachea with the stethoscope. The normal respiratory rate is around 14 to 20 breaths a minute. Then, you have to observe the following. Check if the rate of the respiratory is normal, rapid, or slow. Check also the depth, if it's normal, shallow, or deep. Observe also the rhythm, if it's regular or irregular, such as in chain stokes. Or is there any effort of breathing or no effort of breathing? And then lastly, the blood pressure. You have to study the different types of hypertension in your book in the base. Then you have to remember also this table, the blood pressure classification for adults, JNC8, American Society of Hypertension. I will give you a separate video on how to get the blood pressure correctly. Thank you.